6 skin care tips men should always follow. According to Peter Krause, we sat down with the Bachelorette runner-up from Rachel Lindsay's season to talk about men's skin routines. Peter Krause reveals what men really need when it comes to natural skincare products, moisturizers for winter, and beyond. Why I didn't need the Gillette ad, but there are too many men who do. Gillette's controversial new ad has the internet all lathered up over the company's attempt to address the #MeToo movement, toxic masculinity, and sexual harassment. Is prediabetes damaging sperm and causing fertility problems? Prediabetes, a common but underdiagnosed condition, can interfere with men's sperm health, new research suggests. Learn how prediabetes may be linked to fertility problems and infertility. For men, more veggies may mean less memory loss. A new analysis of data from the Health Professionals follow-up study finds one more reason men should eat their vegetables: a lower risk for memory loss. Leafy greens, dark orange and red vegetables, berries, and oranges all showed benefits. For men, testosterone may drive luxury purchases. Men who received a dose of testosterone had a stronger preference for luxury or status goods than men who received a placebo, new research suggests. Learn more about how biology may influence decision-making. What is female pattern baldness? Female pattern baldness, or hair thinning, also known as female pattern alopecia, is thought to affect about a third of all women, with some estimates going even higher. Female baldness usually involves hair loss over the entire scalp. The hair loss may be most visible on the top of the head, making the natural part of the hair appear wider. Unlike hair loss in men, female hair loss generally don't involve complete baldness. In fact, women usually maintain their hairline in the front and on the sides. Treatments for female pattern baldness and thinning hair depending on the cause of the problem. Minoxidil for women, should you give it a try? Causes of female pattern baldness. Normally, the average individual hair grows slowly and continuously for 2 to 6 years, then rests for a few months before it falls out. Usually a new hair grows from the same follicle shortly thereafter. But sometimes certain conditions prevent new growth. Causes of female pattern baldness are not completely understood, but genetics may play a role, particularly if either parent had a similar condition. Hormone imbalances or sudden health changes are also factors in many instances of hair loss in women. Hormonal changes include pregnancy and the birth of a baby, starting or stopping birth control pills, and menopause. Other causes of hair loss in women are certain medications, including some antidepressants, blood thinners, and chemotherapy treatments for cancer, infection or serious illness, thyroid problems, iron, vitamin, or other nutritional deficiencies. Hair loss may indicate the onset of a disease, including medical conditions as varied as diabetes and lupus. Your doctor may order a blood test to determine if your hair loss could be a symptom of a more serious medical problem. Hair loss treatment for women. There are situations in which no treatment is required, when the baldness or thinning hair will resolve naturally on its own. For example, post-pregnancy hair loss can occur several months after delivery, but regrowth will usually return hair to normal thickness within months. Some instances of hair loss do call for a medical intervention, and treatment for the condition that's causing the hair loss. For example, a thyroid problem usually resolves the hair loss problem as well. If hair loss is a side effect of a certain medication, your doctor may be able to substitute other drugs. While hair loss treatment may not be medically necessary for many cases of female pattern baldness, many women will want to pursue treatment options because they are concerned about their appearance or experience low self-esteem because of the hair loss. Rogaine, minoxidil, is the only treatment approved by the U.S. Food and Drug Administration for baldness or thinning hair in both men and women. It is effective in achieving hair growth in about 25% of women who use it. Propecia, finasteride, a medication approved to treat hair loss in men, has not been shown to work for women. Hair transplantation is another treatment option that may work for women experiencing hair loss. Small plugs of hair are removed from thicker hair areas, such as the back of the head, and surgically placed, follicle by follicle, into scalp areas where the hair is thinning. Hair transplants can be very successful if done by an experienced surgeon. Top hair replacement surgery options. A word of caution: women with hair loss should be wary of advertisements involving light therapy and scalp laser treatments to restore hair growth. Although they may not be harmful, their effectiveness hasn't been proven. Although there are few medical hair loss treatments for women, some women have had good results with cosmetic solutions. Hair coloring, permanents, weaves, and other styling options may help mask the effects of female pattern baldness. Your doctor or dermatologist is your best ally in diagnosing the cause of your thinning hair and suggesting solutions that may work for you. Thanks for watching.